Welcome, everybody. First of all, congratulations for finding the room and to make it to the room without collapsing. So we can thank Taylor Swift for the reorganization of all of the meeting rooms and the floor plan. Because early in January, ASTMH found, or realized, because a younger member of one of the staff members' families said, oh, Taylor Swift is going to be there in New Orleans during the time of Trop Med, which caused a literal earth shake through the leadership of the staff, because it's like, oh God, there's not going to be an Uber, there's not going to be any restaurants, Airbnbs, extra hotel rooms. So the wise decision of Jamie Nishi, that was her first big trial as the new CEO, where she texted me and said, thanks a lot, Karen, was to figure out what to do and how to get it all managed. So everybody acknowledges on the staff team the length of steps, but this patchwork was the only thing available. Otherwise, there would have been no Trop Med this year, which we just could not possibly happen. So with that little preamble, I want to welcome everyone to the session that's honoring Joel Breman and everything that he was and gave and is and still is with us. I'm really pleased to acknowledge the family is here. So Vicki Breman and Matthew and Johanna, and sorry, Johanna, your husband's name is? Tomer. So right here in the front. So we're really thrilled to have them there. And I did text them this morning with a little bit of step-saving tips to not go all the way to the registration desk and then die halfway on the way back to this room. So, so we are here to celebrate the life of Joel, a life well lived in global disease control and eradication, and definitely remembering him with fondness and inspiration. I was thinking this morning about my days with him and how really lucky I was to have all of that. So we've got my co-organizer here with Peter Kilmarks from Fogarty, and JJ Muembe, Anne Ramoyne, Rick Steckety. These individuals represent a tiny fraction of the orbit of individuals that Joel had an impact on. And once you got into his orbit, man, you held on to that gravitational pull, because there was just nobody else like him. His medical textbook is out, The Principles and Practices of Disease Eradication, through Oxford Press. And I just want to send a shout out to Johanna for getting a lot of that through, as well as John Andrews, who really picked up the end and enabled that to come into finally fruition. And then he's got, there's a personal memoir coming, right, as well. When the World is Your Patient, is that what the title is? Yes, that's a great title. So, I've got a little bit of something special for Breman family. There's something called the second line tradition that originated from African American jazz funerals and mutual aid societies. At Joel's funeral in Maryland earlier this year, at his request, he wanted a second line and to hear when the saints go marching in as the procession for his funeral. This is a tradition that originated here in New Orleans to honor those we've lost, and it's quite fitting that there was a processional from the opening ceremony of ASTMH on Wednesday. A second line tradition came through the opening line, and it went all the way into the exhibit hall to be that celebrating. So as a little bit of a tribute from ASTMH to the family, they had this sash worn by one of those in there, and they've got a little plaque for Joel's name right on there. So this is from ASTMH to you. So don't worry, this will be shipped to you. And I know you're downsizing. That's for you to figure out where you're going to put it. I know you've got a few things in your house as remembrances from a life well lived. So we're happy to be able to do that. So thanks to ASTMH for thinking about that. All right, I can have the next slide, please. All right, so this was definitely in one of my first conversations with Joel. Said, congratulations, you know, you're our next president. And Joel said, just tell me what to do and I'll do it. And I said, can you tell every president of ASTMH this? This is the secret to success. So it was true, but he certainly was by no means a pushover. He knew exactly what he wanted, and he also knew exactly what are the kinds of details he didn't want to do, or felt that I could be quite capable of handling it. So it worked out quite well. Next slide, please. So this is just a couple of my fond memories with Joel. And the middle slide there, where he's handing the malaria tie to Senator Coons of Delaware. Joel had seemingly endless supply of these ties, and yeah, and would bring them out. I didn't know that he was bringing it, but Senator Coons, who is well versed in tropical medicine and malaria, has done a lot of Christian work prior to in his early years as senator. He co-chairs the malaria and NTD roundtable there, caucus. So it was definitely a good laugh, and you know, Joel enjoyed it as much as Senator Coons and the audience did. So that happened to be at a Hill briefing that we did in August or September. I'm looking over at Jody Curtis. It was August or September of 2019, when we did not know what was barreling our way. We were showcasing the work of DOD and malaria, and the group picture, I didn't crop it because I just love the fact that he had these sneakers on. So he was definitely taking the metro over. There the lower picture with Chandy John. Joel was really happy looking because he was looking at the end of his presidential year and handing it over. So that was also a very good time. And pictured with me, we were at CDC. There was the CDC series when we were there, and talking about the eradication campaigns. So it was a packed audience there at CDC. So if there's anything Joel loved, was talking to people, talking about science, but also talking about all of the people. So my last slide is the one that was prevalent all the time. His partner in life, Vicky. Vicky was, Joel would call me and have me on the speakerphone. Vicky was there too. It was the true partnership. Public-private partnership in everything, and of course his family as well. And I was thinking this morning about this session. Joel was the eternal optimist, and if there's any time that we need optimism, it's right now. And the last thing that Joel would want is to hear about doom and gloom and hand-wringing, so we're not going to. You know, we're just going to band together, and if there is anybody that runs into a burning building, it's the global health community. So with that, I'm going to introduce the co-organizer, my friend and colleague Peter Kilmarks from Fogarty, because that was another facet of Joel's life that was very important to him.
Thank you, Karen, and good morning, everyone. So I'm Peter Kilmarks. I'm the Deputy Director at Fogarty, and I'm really honored to help organize this session together with Karen, who was actually one of our board members until recently. I'm going to give an overview of Joel's life, and then we look forward at the end to hearing from you. We have time for people to come up to the microphone and share their remembrances and talk more about Joel's life and impact. So Joel was born in Chicago in 1936. He grew up in Los Angeles. He excelled as his high school student body president and as a football player. He then completed his undergraduate studies at UCLA. He was president of his fraternity and he rode varsity crew. He then served in the Army as an artillery officer before going on to pursue his medical education at the Keck School of Medicine, University of Southern California. He joined the CDC CDC-supported global smallpox program stationed in Guinea, and from there he worked to eradicate smallpox and combat measles across West and Central Africa. Joel then pursued further training in infectious diseases at the Harvard Medical Service at Boston City Hospital and the London School of Hygiene and Tropical Medicine, conducting research in Africa Francophone countries on immunizations and malaria. In 1976, Joel's expertise was called upon during the response to the first outbreak of Ebola hemorrhagic fever, and we'll hear more from Prof. Muyembe about that, in the Democratic Republic of Congo. He then assumed several quite significant roles at WHO, overseeing the certification of smallpox eradication and pioneering research on human mpox. Returning to CDC in 1980, Joel expanded the malaria branch's reach and impact in Africa. Then in 1983, and we'll hear more from Rick Steckedy about that, but then in 1983, Joel became the Associate Director of the National Vaccine Program Office in Washington, D.C., and then joined the Fogarty International Center 2 years later. At Fogarty, Joel's leadership was transformative, really establishing the research programs focused on emerging infectious diseases and other global health initiatives. Then in his emeritus years, and he was more active and productive in his emeritus years than most of us are in our regular careers, but he continued on collaborating on research, defining the burden of malaria, and also the pervasiveness of poor quality and substandard drugs. He taught a course on disease control at George Washington University, served as the president of ASTMH, and consulted for WHO, the Carter Center, the Gates Foundation, USAID, FDA, and the Multilateral Initiative on Malaria. Joel was then co-chair of the WHO International Commission on the Certification of Dracunculiasis Eradication. He co-edited a medical textbook, as Karen mentioned, The Principles and Practice of Disease Eradication, that was published in October, and then also mentioned his personal memoir is forthcoming in publication. But beyond this, and as we'll hear more about beyond these professional endeavors, Joel's life was remarkably rich in other diverse interests. An avid clarinetist, writer, adventurer, he really embraced life's joys with boundless enthusiasm. I thoroughly enjoyed my interactions with Joel since I came to Fogarty in 2015. We had much in common, including rowing and past appointments at CDC, working in Africa, a love for African textiles, and also participating in responses to Ebola and other infectious diseases. I would often stop by his desk at the end of the day and hear about his latest endeavors, remarkable stories and insights into past and current public health events and personalities, past and present. So thank you all for coming. We're really here today to honor an extraordinary life lived with purpose, with dedication, and with love. His legacy continues to inspire us at Fogarty, and I think many people all over the world, truly guiding our efforts to create a healthier and more equitable world. I miss him.
Dear colleague,
next we're going to have a video from WHO Director General Dr. Tedros, and then we'll welcome Prof. Buyembe to come and give his remembrance.
dear colleagues and friends, I'm honored to join you in remembering the work and life of our friend and colleague, Dr. Joel Breman. Joel was at the forefront of addressing some of the most important public health challenges of our time. He was one of the leaders of the original team to journey to Yambuku Mission Hospital in 1976 to investigate an outbreak of a mysterious disease we now know as Ebola. The accomplishment of which he was rightly most proud was his work as Deputy Chief of WHO Smallpox Eradication Unit, which led to the historic eradication of smallpox. Joel also brought his talents to neglect tropical diseases, including chairing WHO's International Commission for the Certification of Guinea worm eradication. Even into his 80s, he was traveling on behalf of the program. Joel was not only a great physician scientist and public health advocate, he was also a wise and generous teacher and mentor to many great figures in public health today. Joel had one of the most important qualities in medicine and health. He was a good listener, taking the time to talk with and learn from the communities he was serving. Joel leaves behind a legacy of great public health accomplishments, and as a physician, mentor, and friend who was both fearless and kind. We mourn his passing, celebrate his life, and honor his legacy.
There was no hesitation when we contacted WHO that they would do this. Dr. Tedros mentioned a good listener. Boy, he definitely was that. Okay, so some of you may have seen in the app that we're going to have a video from Dr. Fagey. Unfortunately, we weren't able to do that, and if the app has been refreshed, it wasn't even there in the first place, so you're wondering, what am I even talking about? But if you're like me and didn't refresh the app for a while, and I saw it. So I do want to at least mention that, Dr. Fagey had said eradication is an optimist sport, and we believe that he had Joel in mind when he said that. So next we will have hear from Professor Buyembe. So Professor, you want to come up?
Dear Madam Breman, the family, dear colleagues, ladies and gentlemen, let me begin by extending a warm greeting to all of you in my capacity as an honorary international fellow of the ASTMH since 2020, when Joe Breman was the president of this prestigious society. I bear this title with pride and honor in memory of my friend and brother, Joe Breman, who left us on April 6, at the end of a life well lived in the service of all humanity. The seed of our friendship had germinated on fertile soil of African tropical infectious diseases. Before coming to Zaire, now the DRC, Joe Breman already had a lot of experience in the fight against Guinea worm and smallpox in Burkina Faso. He was passionate about infectious diseases, for which Africa was the land of choice. It was impossible to separate his passion for fighting infectious diseases and his love for Africa. Joe Breman was therefore a friend of Africa and African scientist. In September 1976, the Yambuku mission in the Equateur province was affected by a mysterious deadly outbreak. The government of DRC requested technical assistance from the WHO, which had mobilized its collaborating centers, including the CDC Atlanta. Because of his African experience, Dr. Joe Breman was recruited by CDC and sent directly to the epicenter of the epidemic in Yambuku at the head of an international team, including microbiologist Carl Johnson and Peter Piot. Joe Breman was a jovial and humble man who had easy contact with others, not only with scientists, but also with ordinary people. This was his great asset in investigating this epidemic with confidence in the population, in particular to understand its modes of transmission in the hospital and in the community. The hospital was the main source of contamination for the medical staff, who had no glove or disinfectant and no running water to wash their hands. They examined the sick with bare hands. The hospital was also the amplifier of the epidemic by using glass syringes and unsterilized needles. According to local custom, the population prefers parenteral rather than oral administration of drugs for treatment of fever and pain. Another factor in the amplification of the epidemic observed by Dr. Joe Breman's team was the dressing of bodies for burial practice by the population in accordance with local custom. In addition, in the Congo, it is customary for women in affected families to shave their heads as a sign of mourning. Joel had based himself on this other socio-cultural aspect to conduct investigation in the villages and to follow up on contacts among the villagers. In my life, I have investigated more than 15 Ebola outbreaks in DRC and in other African countries. To paraphrase what Peter Piot said, everything I know about investigating an epidemic, I learned from Joe Breman. Joe Breman's inaugural work during Ebola outbreak in Yambuku paved the way for future outbreaks investigation and response in DRC and other African countries. The greatest legacy that we receive from Joe Breman and that we continue to transmit in turn to the generation of microbiologists that we trained in DRC is this famous little epidemiological triangle which simplifies the description of an epidemic to a few terms of people, time, and place. In my opinion, Joe Breman is the inaugural father of field epidemiology, which Wikipedia defines as the application of epidemiologic methods to an expected health problem where a rapid insight investigation is necessary for timely intervention. This is exactly what Joe Breman taught us, and we in turn teach currently at the Field Epidemiology and Laboratory Training course in Africa under the mentorship of CDC and WHO. In recognition of his leadership in the investigation of the very first Ebola epidemic that led to the discovery of the Ebola virus in 1976, the government of Zaire at that time elevated him to the rank of officer of the National Order of Leopard. It was a well-deserved reward. As we say in French, derrière un grand homme, il y a une grande dame. Behind this great man, there was a great lady. This great lady is you, Vicky Breman. You deserve our applauses. Thank you for your attention.
Thank you very much. And now I've got the pleasure, another pleasure of introducing Rick Steckedy. Rick?
Thanks, Karen, and thanks to everybody for being here. It's a real honor to be able to talk to you. I first met Joel in 1985. I had just completed my Epidemic Intelligence Service work in the state of Wisconsin, and I got an opportunity to come to Atlanta and get a full-time job in the malaria branch with Joel as my supervisor. We worked together directly for the next 8 years, but that relationship has continued with his family and with Joel for the last 40 years. And so it's really a special time to think about that. Joel had come back recently from West Africa. You just heard about that, and his work in the smallpox, his work in Ebola, and some of the other infectious diseases. And he clearly loved the field work, and he loved the challenges, and malaria was one of those challenges that he took on next. He became a close friend, and in honor of his choice of ties that he's given to lots of people, he gave this one to me. And I just wanted to point out how many people he touched in personal ways, not to mention professional ways. So to pay a tribute to his work in malaria, I just wanted to go into two things. That is, what did Joel do, and how did he do it? How do we do slides here? So in terms of what did Joel do to provide leadership and mentorship in local, national, and global malaria science and program? He actually replicated what he did with Ebola. Next slide. He worked in the field. He worked with local people in order to figure it out. Next slide. And as you saw previously, he actually got recognized by, but also engaged with leadership in the countries. So for malaria, It's an interesting time to think about. So Joel came into this in 1980-ish, give or take a year. At that point in time, this was a decade after the ending of the global malaria eradication program. There were only a few old tools that he was working with. That is, we had diagnostics via microscopy, and not everybody had a microscope. We had a few drugs, chloroquine, amodiaquine, sulfadoxine, pyrimethamine, quinine, and there was resistance being shown to every one of those. Fever was considered malaria in sub-Saharan Africa because we didn't really have a confirmatory diagnostic for everybody. National programs were nascent at best. His focus was on children and pregnant women, and he liked to count. But counting felt like a guessing game when you were counting fevers, not actually counting malaria. And some of those places, malaria was considered your friend. That is, you lived with it. And as long as you survived it as a child, you weren't going to get terribly sick. Well, what's happened in the 40 years? There's a new point of care diagnostic test. There are new artemisinin drugs. And while we've got potential drug resistance, we've got ongoing work in our science to address that. We have problems with our insecticides as well, but again, we're addressing those. We've expanded our approaches for case management and prevention, both short and long-term, long-acting drugs. We've got prophylaxis, we've got intermittent treatment, and then we've got partnerships and a lot more resources than we had when Joel was beginning to work on this in 1980. Rollback Malaria Partnership, work with WHO, UNICEF, the World Bank, all joining hands and going into this, and subsequently the Global Fund, and the Bill and Melinda Gates Foundation, and many others. National research programs and their capacities had been strengthened around the world. And malaria infections and cases were being confirmed in places and counted that way rather than just counting fever. And lastly, it was very clear that malaria was not your friend. An elimination of it, eradication of it, hopefully, eventually, was part of where you wanted to head. Joel wanted it put on paper. So this was his counsel to me one day. He said, you're going to a WHO meeting in Geneva with a lot of smart people with good ideas. The ideas that will win the day will be the ones that you put on paper in advance. That allows you to be clear with yourself what those ideas say and allows others to read, ruminate, and make them better. So Joel worked and published on essentially every aspect of malaria. So that transition that I showed you in those previous slides, going from, sort of the dark days of post-eradication, not much resources, and a lot of problems, to the transition that we've had over the subsequent 40 years, Joel worked on this. And Joel worked on it not just during the 8 years that we knew each other at CDC, but ever since then as he transitioned to Fogarty and to the work that he's done with the many people that Peter mentioned earlier. Half of Joel's publications were in malaria. So, as I say, he liked to put it on paper. It's interesting how you count publications. One of the things I realized was Joel only had 150 or so publications, and half of them in malaria. What Joel had also that's not listed in your CV on publication lists is Joel had edited and collaborated on so many different reports. He actually listed those. It's almost as many as his publications. And those are all with multiple people around the world helping, and with Joel helping edit those. So his contributions were just incredible, and putting them on paper, critical to the world. So how did Joel do his work? Well, he was a point person at CDC's malaria branch in the 10-year Combating Communicable Childhood Disease Program. That was essentially CDC's first opportunity to go into program malaria work in Africa. And that's what Joel taught me about, taking me first to Zaire on anti-malarial drug resistance. Was chloroquine working? Next. Joel worked with a lot of people in malaria branch. This is just actually a subset. We took a picture every year, but so many people were traveling that this is about half of the malaria branch. Next. I got a chance to work with a bunch of other young people with Joel on the right-hand side of this slide, and recognizing that Joel was sort of the senior statesperson. He had more gray hair than the rest of us. He actually was 7 years older than the branch chief, and more than 20 years older than some of the EIS officers in this photo. But as somebody pointed out, how do you work with so many people smiling and enjoying the process of working together? And Joel was really part of making that happen. Next slide. So here he was working in Cote d'Ivoire with an anti-malarial drug resistance program. Next. He really liked working in comprehensive hospitals in Ibadan, Nigeria. He was really good with kids. And then you have to think about, well, we're celebrating Joel. We don't celebrate everybody who passes. Joel was not just good. Joel was great. What made him great? Well, first of all, he was the quintessential epidemiologist. Joel counted when others didn't believe the data. The clinical practical scientist. Joel evaluated drug resistance with methods that allowed locals to replicate the work. He was a learner, he was a supporter of people in programs, and he was always an explorer. Next. I just wanted to highlight two things here, the epidemiologist of Joel, and two, the clinical practice and practical specialist. Slide. These are a series of articles, happen to be essentially all put in the American Journal of Tropical Medicine and Hygiene, where Joel worked with others to count how much burden we had of malaria, and he did this repeatedly. And Joel, I don't know whether Joel coined this term, but he talked about the ears of the hippopotamus. His African example of what we thought, what those of us further north call the tip of the iceberg. And Joel loved thinking about the ears of the hippopotamus. Next. In terms of practical science, one of the things that I'm raising this issue because we've actually gone back and forth on this. We had methods for looking at drug resistance in the early 1980s. WHO had a set of guidelines as to how to do that. You followed individuals for 42 days. You sometimes hospitalized all of them. I'm back, sorry. And WHO in vivo test couldn't be done in most places, but local programs were developing. They wanted to know how to do this themselves. And Joel worked out with the statisticians and with people doing sampling to figure out how to do this over 7 days in a way that the national program could do it, and the national leadership could make decisions, yes or no, they did or didn't have parasite resistance. We've actually gone back to 28 days or 42 days and added additional laboratory testing on things. it's important to think about where we've come from and whether we've actually gotten better at that process. But Joel was a leader in questioning that issue. Next slide. So how did Joel do this? Well, Joel was an explorer, and here's the example of, on the left-hand side, Joel loved music. There was no musician he wasn't going to stop and talk to about his instrument. And then Joel loved masks, and so there wasn't anybody whose mask he didn't want to examine. A number of people have seen Joel's and Vicky's collection of African stuff, materials. You know, both the cloth as well as the many, many wood carvings, the masks, etc. Next slide. You've seen this photo, so this is again a testimony to Joel was not alone. Joel was in a partnership. Next. And Joel's partnership raised a couple of kids. Next. And those kids with their partners gave Joel and Vicky some children, grandchildren. And there's an extended family, and Joel was really proud that that entire family was malaria-free. So Joel, thanks. It's been an honor working with you. I'm sure you're here today.
Thank you, Rick. So next I want to introduce someone else that was very much in Joel's orbit, Annie Ramoyne. Annie.
Is there a slide changer? Oh, this is the slide changer?
Yeah, this is the clicker pointer thing? Yeah, clicker pointer thing? Yeah.
And it changes the slides? Okay, perfect. I just wanted to make sure that I had the actual slide changer. That's beautiful. Okay, I feel so humbled and honored to be here, to be a part of this, and to follow these incredible speakers. You know, it's a real honor to speak today about my friend, my colleague, my slide clicker, thank you. You know, Joel, a man whose contributions to global health are as profound as his warmth and his generosity. You know, today we're here to celebrate Joel's life and his legacy, honoring the warmth he brought into all of our lives, the wisdom he shared with the field, and the transformative leadership he brought to global health. So, you know, let's see, I'm gonna try this and see if it clicks. Oh, good. I had the privilege of introducing Joel at his presidential address for ASTMH a few years ago, and that moment really allowed me to reflect deeply on his extraordinary legacy. And I was also fortunate to spend many hours on Zoom with Joel, with his wife, Vicky, who we all know and love, his children, capturing the essence of his life for that big event. And what struck me most, what really struck me was how full his life was. It was filled with compassion and humor and an unshakable dedication to global health. And, you know, I just wanted to show some of these slides because they were, you know, so comprehensive, and so I feel I have a little leg up, and I'm a little luckier that I had all of these beautiful slides and beforehand. But and the pictures were so lovely, you know, and really understanding who he was as a whole human, you know, somebody who you know, had a life as an athlete and a person who, you know, had lots of family and friends and, you know, was the president of his class. He was voted most popular at Hamilton High School, and I assume he probably would have gotten the same award right here at ASTMH if we had had that opportunity. He really, was a full-bodied person, and I think that a big piece of it is that he really didn't actually start out wanting to be a physician or a scientist. And in fact, little known fact, Joel Breman's undergrad degree was political science at UCLA. Just have to put that little piece in there. But, I just think that showed something about his whole person and how he really thought of things in a holistic way, and that was so important. So just a few more of these pictures. I met Joel over 2 decades ago, back in 2002, when I was a program officer at NICHD, just after my PhD, and starting out with my work on monkeypox virus in DRC. And I had what many people thought was kind of a wild idea with my colleague, Professor Moyembe, of reintroducing enhanced monkeypox surveillance in DRC, and Joel immediately embraced it. He became my champion, reviewing protocols, providing advice, encouraging me every step of the way. And for a junior scientist, then moving on to navigate academia, his support was invaluable. He opened doors, wrote letters, always invited me to the table. And beyond that, he welcomed me into his family. His kindness always unreserved. And I'll never forget that Shabbat dinner we all had together, or many dinners at ASTMH and in Los Angeles when he and Vicky would come. He became my mentor and my friend, not just shaping my career, but also a lot of my perception of life. Joel had a very simple yet profound mantra that guided his life, and Matthew, you gave me this directly. Cherish family and stay vertical. And this really captures the essence of who Joel was. Resilient, grounded, filled with gratitude for life and family. And he lived by these words, dedicating himself to the people and communities he cared about with unmatched warmth and generosity. From his early years in Chicago and LA, Joel was just somebody people gravitated towards. And later, as an epidemiologist, it remained the same. He led with kindness, humor, and a deep sense of human connection. And his warmth was innate and touched everyone who knew him. He had an extraordinary way of making people feel valued. And he always brought people into his family. And that is something that, we know also emanates from Vicky, and something that she also, as his partner, really brought us all together, and we all feel so very lucky. He spoke frequently of his family. And Johanna and Matthew, we all knew about you long before we met you or were brought into your life, because he really did share that piece of himself with all of us, and I think that's so important. And in doing so, he always made everybody feel valued. I have so many anecdotes from friends, from colleagues that are sitting here today of how he made everyone feel valued. Chelsea Hansen, one of Joel's mentees, reflected that even though Joel mentored hundreds of students, he remembered everyone's name, career paths, and even little teeny details about their lives. And it wasn't just a skill, it was a reflection of his immense care for others. And he was a gifted storyteller. We all know that. I think about those dinners. It was just amazing. And Lori Garrett described him as someone who loved to talk and talk and talk. But she pointed out Joel never tooted his own horn. He had endless stories about his adventures, his scientific work, and the people he met along the way. And Lori said, if you want to understand Joel's remarkable life, all you had to do was buy him dinner, ask a leading question, and sit back and savor the tales. So when I was honored to give this talk the last time at ASTMH, I asked many people I knew to give me 5 words to describe Joel. I really wanted to capture his impact from as many perspectives as possible, and there were so many people. I had an onslaught of people who wanted to share stories that I just decided to ask for 5 words that described him, and the response was overwhelming. It was from luminaries from the scientific world, Cliff Lane, Larry Brilliant, Bill Fagey, Ken Bridboard, Peter right here, Karen, you too. We had so many people sending back their heartfelt tributes. And when I asked Roger Glass, right here, for 5 words, he gave me 10, reflecting on the breadth of Joel's influence and character. And he described Joel as his 10 words were creative, mentor, integrity, risk taker, that was hyphenated, teacher, commitment, visionary, tenacious, wise, globalist, and African expert. I mean, it really does describe him. And Roger also shared his admiration for Joel's ability to launch students and mentees into successful careers. He highlighted his groundbreaking initiative on fraudulent drugs, sparked by concerns about artemisinin resistance, which turned out to be a much larger issue, and of this issue of fraudulent and substandard drugs. Roger, you called Joel an amazing star and a guru of tropical medicine, noting that his legacy that spanned from smallpox eradication to the discovery of Ebola and Guinea worm and his work on advancing global health just really pushed the next generation of leaders. And Roger concluded simply, Joel's a gem. Couldn't be more true. You know, for those of us who knew him, Joel's wisdom was a constant source of guidance. And this really was around his leadership in global health, you know, his spanning of all of these years. I don't have a really good reason to put this photo up of him in Zaire, but I love this photo so much because it just shows just how at ease he was in the world, in the middle of an Ebola outbreak on a pirogue. And there he was, you know, his caring while he worked on mpox or smallpox, his ability to bring people around him, and how everybody really did look to him for mentorship. You know, I often find myself asking, what would Joel do? And the great news is that Joel was consistent, and his message was always clear. He didn't just teach us what to do, he showed us how to think, how to connect, and how to care. So while he's no longer with us, when I think about it, I actually know exactly what Joel would tell me to do. He charted a path of warmth and wisdom and global health leadership, one that we'll all aspire to follow. You know, his career was marked by an insatiable curiosity and a commitment to service, and he really showed us how to do it. His work often took him to the field where he was just very at ease, and also to meetings where we would celebrate his life. And his style was one of humility and collaboration. You know, I have so many examples of all of this, but you know, I think seeing these pictures of him with all of his mentors at various mentees at various meetings, and where he was enjoying life either at a dinner or Yassim's wedding, being the first to pop a cork off of a champagne bottle, we all knew his dedication was heartfelt and transformative. We have so many other people. Jamie Lloyd Smith, who met him early in his career, remembered some of his depth of experience was so clear, and as when at the time where many people might have dismissed modeling as an approach, Joel generously sat down, shared his insights, going way back to outbreak investigations in the 70s, and was wise, generous, and as an encyclopedia of knowledge. I have words from Sophia Gruskin, who's at USC, talking about how he treated everyone with respect and dignity and qualities that don't always come around easily in our field. He wasn't just a guide, but a role model for how to approach global health with compassion and humility. You know, we now have Joel's book, which I just promised I would put up here, something that what I should have done is put the list of chapters in here where you would see, basically everybody in this room probably has some impact on a chapter here. and how important it was. This was really summing up 50 years of experience and knowledge, and we're all so grateful. He has a lasting legacy. His impact on global health is immeasurable. From smallpox eradication to malaria surveillance, his contributions have shaped the field in countless ways. His ethos, his kindness, curiosity, and dedication will endure. And Tony Fauci summed it up best. Joel was brilliant, humble, warm, and honest. These qualities defined his work, his mentorship, and his life. For those of us who knew him, his memory remains a guiding light. He reminds us to build bridges, to pursue excellence, and to always remember the humanity behind every data point. Let's honor Joel by embracing the values he held dear. He showed us that meaningful change is possible, and it's up to us to carry forward the work he began. Joel, you've shown us that we can indeed change the world, one step, one person, and one initiative at a time. I so miss you so much, but I'm so glad we're all here to just carry on what he asked us all to do. Thank you so much.
Okay, I'm going to read something from Don Hopkins. Donald Hopkins is the special advisor for guinea worm eradication at the Carter Center, and he couldn't be here in person, but sent us something that he wanted us to read. So from Don Hopkins, this symposium is the latest in an outpouring of deserved tributes to Joel Breman since his much lamented passing 7 months ago. Much has been written about his many accomplishments, including significant contributions to the work of this society, ASTMH. His passing is also a very sad loss for me personally and professionally, and I'll take this opportunity to recall 2 instances when we worked together. Our careers aligned most closely during the late 1960s when we both were young epidemiologists in the smallpox eradication program. We worked together again in the guinea worm eradication program during the first 2 decades of the 21st century when we were mature public health practitioners. Joel made important contributions in both of these eradication programs. Joel and I were among CDC's second wave of assignees to help eradicate smallpox and control measles in West and Central Africa after training at the then Communicable Disease Center in Atlanta in July and August of 1967. Joel was assigned to the Republic of Guinea, and I went to Sierra Leone next door. That year, Sierra Leone and Guinea respectively reported the highest and second highest rates of smallpox in the world to the World Health Organization. Sierra Leone reported 1,697 smallpox cases, or 68 per 100,000 population, and Guinea reported 1,530 cases, or 40 per 100,000. Helping to start the smallpox eradication program simultaneously in two high-profile neighbors, it was inevitable that we competed to see which country would reach 0 cases first. Guinea was 2.5 times larger geographically and had 25% more people than Sierra Leone, but Guinea's mass vaccination effort was managed through its political party leaders and more efficient than Sierra Leone's mass vaccination, which operated through traditional chiefs and public health officials. Sierra Leone began using the new surveillance containment strategy in mid-1968. Guinea reported its last smallpox case in January 1969, and Sierra Leone reported its last case 3 months later. These early victories in 2 of the most challenging countries galvanized the global smallpox eradication program. Except for nostalgic reunions of veterans in the smallpox eradication program, our paths diverged over the next 2 decades while Joel helped manage the World Health Organization's elaborate process for the certification of smallpox eradication in Geneva, led malaria and other work at CDC in Atlanta, and then at the Fogarty International Center in Washington. Our lives converged again in 1995 when WHO appointed Joel to one of the original 12 members of the International Commission for the Certification of Dracunculiasis Eradication. Joel had been sympathetic to the early guinea worm eradication efforts at CDC, but had not been directly involved except during a visit to Pakistan for malaria work in 1983, when he facilitated young Epidemic Intelligence Service Officer Frank Richards' effort on behalf of the informal guinea worm group at CDC to inquire about guinea worm surveillance data in Pakistan. Joel's experience with certification of smallpox eradication during his years at WHO headquarters was perfect preparation for his new role on the ICCDE. I admired and valued Joel's contributions as a member and then deputy chairman since July 2019, chairman of the ICCDE. He led several international certification teams that visited Niger, Cote d'Ivoire, Ghana, and Kenya, and served as a member of teams to some other countries to assess their preparedness for certification of guinea worm eradication. He brought all his accumulated public health experience and deep knowledge of infectious diseases, as well as his calm demeanor, patience, and warm humor to bear while facilitating high-stakes decisions and guiding often contentious discussions. With Joel's participation in leadership, the ICCDE certified 200 countries, areas, and territories to be guinea worm free, with only 6 final countries remaining to be certified, including Sudan, which has not reported an indigenous guinea worm case since 2002. We miss you, Joel. Thank you for all you did to the benefit of humankind. May God bless you, Vicky, your children, grandchildren, and all your family. Now we have time.
Yep, we have time.
And so please come up to the microphone to share your own remembrances, your own reflections. Roger Glass, please introduce yourself and
Wow, this is quite a session. I'm really touched by it. Hey, can you hear me? Is the mic on? Yeah, now it's on. I met Joel in 1976 at CDC, right before I joined, and he was really a class act, having already worked on Ebola and smallpox. So much has been said, but after spending time in Burkina Faso, talking to me forever on my career and things, he ended up at Fogarty. Lo and behold, I didn't know what Fogarty was at that time, but I became director in 2006, and we were friends throughout his NVPO years, and at Fogarty even during that. But when I came on, he really had a special place. First, one for Trop Med. He introduced our extramural program on the ecology of infectious disease and emerging infectious disease, which has brought our network meetings to this society for the past 25 years or so. He also taught at George Washington throughout his last years and brought all of his friends in to speak about their favorite diseases. So I got called in to speak about cholera. And the students were really enlightened by these amazing events, the stories that we told that all became serialized in this textbook that's occurred. Every time I talked to him, he never talked about me. He would talk about his family, the grandkids and the like. And that was the first thing on the agenda. Then he talked about his mentees, like Ann and Yesim, who's here, and these crazy ideas that he developed from the start with the fraudulent drugs that went into his interactions with Interpol and this beautiful woman at Interpol who led the investigations. And even in his illness, I would go to see him. He'd never talk about himself. First question is, what are you doing? What's new? Whatever. Then he'd talk about his kids. Then he'd talk about, he wanted me to read, and of those of you of my age, The Hitchhiker's Guide to the Universe. What a great book for someone who was tromping around the universe. He was such a visionary. He was so wonderful to be with. Even in his last visits with him, I had lunch with him, took him breakfast, and it was never about him, however sick he was. It was about everything that was going on. Joanna, you were the love of his life for taking on his personal memoir that's going to be published. I know he spent time at a class to learn how to write the diary and his memoirs, and that you were there to help finish that up and bring it to closure, and we're all looking forward to seeing that. So yeah, that was just absolutely special. There's so much I can say. As another Jew in the family here, I would say that to me that's personalized by calling him a mensch. Really the highest kind of regard for someone who had done so much for so many people in his own humble but really inspired way. So to the family, you can see the joy that we all have having interacted with Joel over, for me, almost 50 years. Thank you so much.
Thank you, Roger. Anyone else want to come up to the microphone? You can line up at the microphone just like you do with the rest of the sessions at TropMed.
Hi, I'm Sean Murphy. I'm at the University of Washington now, but I'm lucky to be one of Joel's trainees. And everybody should be as lucky to feel the way he made me feel. So I met him in the Peachtree Hilton lobby in 1997. I had flown there to ask him if I could work for him at the NIH that summer. I was 19 years old, and I really had no place doing that. And of course he said yes, and then he made it feel like it was such a normal thing and that we were already rolling. And that was an amazing summer for me because we work on vaccines and diagnostics now, but that summer we worked on the burden of malaria. You know, we published a paper before the hippopotamus years, and that has informed me all along, you know, because it was about why are we doing this? And if you can't count what you're doing, if you can't count how much disease, then how can you do anything about it? So that has informed my career all along. But there were some funny moments at the end of that summer. You know, he thought, well, what would be better for Lou Miller, Harold Varmus, and Tony Fauci than to get an invitation to come to my talk, because I'm sure they had nothing better to do. They did not all come, but what I liked was how brazen he was in inviting people and making his trainees feel really, really special. There were other moments. I've been coming to this meeting since 2000, and every year we would meet here, and every year we would go to dinner. We went to dinner, the two of us, with you a couple of years ago. We had a dinner once, Carl Johnson, Joel Breman, and me, and a few other people, and they're regaling us with stories from the Ebola investigation. And you know, you have to pinch yourself and be like, I'm with tropical medicine rock stars here, and they're telling us about all the amazing things. And so I just feel really grateful. You know, I think he was very clear-eyed about what we were doing. He was very tireless in his pursuit, and I think most of all, he was always willing to make the circle bigger and to add people to that circle. So I'm forever grateful to him and to you, Vicki.
I'm Barney Klein. I've learned so much about Joel today that I didn't know, and I want to thank the speakers for that. Whenever I think of Joel, there's one encounter that occurred about 40 years ago at CDC when we were both at CDC. You remember? And our daughter was in the Girl Scouts, and they were selling Girl Scout cookies. And she's very, you know, wants to go get it. So she convinced me to take her to Chambly, where we were in our Quonset huts. And visit a few colleagues. I felt a bit uncomfortable about that. Probably in retrospect, it wasn't a good idea, but I did. And we marched down the hall, and almost everybody kind of waved us off. No. But Joel, come in. Not only did he come in, Joel insisted my daughter sit down, and he talked to her. He wanted to know about her, what she did, where she went to school, what her plans were. And you may remember he brought back a box full of candy, of cookies. I never had the pleasure of working with Joel because I was on the helmet side and these guys were on the malaria side. But Joel is deep in my heart. He's been an inspiration for my full professional career.
Thank you, Barney.
Morning, I'm Dan Bausch. And unlike most of the people who have spoken so far, I actually didn't know Joel particularly well or particularly long. I met him through my involvement with ASTMH. Most of you know I'm a past president of the society. And so when I came in, I was the president-elect when he was the president, I think. And I might take exception with this idea that he just said, tell me what to do and I'll do it. That wasn't exactly the experience that I had with Joel. I think he would do it, but he was gonna process it and think through it, and he was, dogged in the way he thought about things, but for all the most noble causes, and that included ASTMH, and he really kind of took that epidemiologist's eye to ASTMH as well, and counted things and thought about, okay, what are the next steps, and the determinants of different things, and were the meetings going the right direction, and so it was really kind of that same scientific and dogged process that he had dedicated to epidemiology in the field and malaria and smallpox and things like. He applied that to the society as well, so I was always impressed with that and kind of that approach. And then not only was he dogged about the science, but as everyone's detailed so well, he was dogged about the kindness, and he was dogged about the optimism in the world. I think that's a message probably that we should all take into account these days about optimism. And there's a saying, I don't know where it came from, that I always liked and I kind of use in my life, is that someone who's nice to you but not nice to the waiter is not a nice person. But Joel was always nice to the waiter. And I think he would be just as proud about how nice he was to the waiter that he would be to anybody else. So thanks very much.
Thanks, Dan.
So continuing maybe on Dan's thoughts, Chandy John from Indiana University. I had the great privilege of being the president of ASTMH before Joel, and Karen joked that we might have had the greatest age disparity between presidents of any current president and president to come. And what struck me about Joel, of course, everybody who works in global health knows Joel, so I knew about his work from the time I started working in global health. But I hadn't had a chance to work with him until that president-elect role. And it just so struck me that he was as enthusiastic about his work in global health as somebody just coming into the field, maybe more so. And to be in your 80s and have that incredible level of enthusiasm, like everything was new, was just a blessing to all of us. The other thing was that, and Dan sort of alluded to this maybe a little bit, if Joel had an idea, and Karen was like, well, we don't exactly do that in ASTMH that way, and I was sort of like, well, for the past 2 years of being president-elect and president, I'm not sure that will work. Like, if Joel cared about that idea, he would just stick to it. He was stubborn, and it could be frustrating for the people who worked with him. But you know what? What I learned from that was sometimes you just gotta frustrate him if you really care about the issue, because if it's important, and he could just push for it. And I think Karen and I both really learned from that like, hey, this guy is not gonna let go. Let's think about this some more. So to his family, he was just a gift to the world, and everybody in ASTMH appreciates him so much. Thank you.
Yeah.
Hi, Bill Brieger from Hopkins, but I really consider myself the University of Baden. where I was working in 1987 when Joel brought his team to study chloroquine resistance in our rural health center, which, thank you for showing the picture. They called it comprehensive, but that was a political name, not a practical name. But Joel made himself very much at home. I was the coordinator of studies for our medical student training program there. It's about 60 miles from the university itself in Ibadan. And so the team made themselves at home, but of course, they welcomed me in. I was, I guess, technically the host on the site, but I wasn't involved in the direct studies. But in the evenings, it was so great to hear his stories about Ebola, about everything, to see the way he interacted with the team, mentoring them, and taking time with our medical students in the evenings too. So this is something I'll always remember. So we want to thank him for his life and continue to be inspired. Thank you.
Oh.
Hi everyone, I'm standing in front of you with a heavy heart, but I know what Joel would say. Chin up, Yeshem. Joel was my mentor and supervisor during the postdoctoral year I spent at the Fogarty International Center in 2006 and 2007. I vividly remember attending my first ASTMH meeting in 2006. Joel introduced me one by one to every person that he thought I should meet in the society. Over the years, his supportive hand never wavered, whether at this meeting, in other professional circles, settings, and throughout my career. I know for a fact that this holds true for all of us fortunate enough to be mentored by Joel. Over time, I have come to realize that taking on a trainee is both a noble act and a profound responsibility. Joel embodied humility and kindness in this role, shaping the next generation in meaningful and lasting ways. I can only hope to serve others with the same compassion and selflessness that Joel displayed right up until his very last day. Because I just remember my last meeting with him when he could still talk at the hospital. All we talked was about me and what was I supposed to do with the society and in my career. It was as real as that. One memory of Joel remains especially close to my heart. As a new faculty member in Boston, I received 2 life-changing pieces of news. This is how it goes, I guess. My first breakthrough grant with fieldwork in Thailand and Sri Lanka, and the news that I was expecting my first child. I was both excited and super anxious. Joel was visiting Boston for a meeting, and we had plans to celebrate the grant together. When I showed him my baby's ultrasound, and he was the first one to know in the professional circles that I'm expecting a baby, he gently took it from my hand, and that very famous smile, a big smile, spread across his face, and his calm and gentle way, he said, "Yeshem, the baby is nested within a heart." I hadn't noticed that detail within the heart. That detail in the ultrasound image. I looked at that image many times, but I didn't see that, the baby was sitting literally in a heart. And then he assured me everything is going to work out. I remember letting out a deep breath, and just as he said it did. Joel lives on through all of us, whom he mentored and supported, and he will forever remain in my heart. And I'm so blessed to be with the family, introduced to the family, and I guess we will all remember him and hold on to one another and try to keep on the legacy and the torch that he passed over to us. Thank you.
Thank you. So one of the things that has not been brought up, but it is an essential piece of the researcher's life, is the understanding of the political connections to funding for the research. ASTMH has had for a long time extremely competent partner in our government relations, Jody Curtis, who's sitting right over there. And Joel would refer to her always as Team Jody. Where are we with Team Jody? Where is Team Jody? So Jody texted me this story, which you have never shared with me before. She said, my favorite memory, which I am never sure I told you, despite all of his accomplishments, he listened and took direction and trusted others. When we went to the Hill the first time, and I told him we would only have 20 minutes in a meeting to explain why Congress should fund global health research, he looked at me and kind of did a and said, that is impossible. And we all know how Joel likes to talk. I wasn't sure how this was going to go, and I felt like, who am I to tell this legend to keep it to 20 minutes? But it was I who was stunned when he finished up his brilliant background in 19 minutes on the dot, and turned and looked at me with the biggest grin on his face. Joel understood as much as this man liked to talk, except in those brevity of emails. For a man who liked to talk, there was like 6 words in an email. That was it. But he could condense things into the absolute high salient points for what a congressional staffer needs to hear, not what a scientist needs to hear. He could make that connection in a way that was understandable, relatable, passionate, and clear. And that's what we desperately need. And it's a challenge for researchers who, all of you are in the details to then get out of the details. So that was definitely one piece. He certainly understood that about, all of his concern and being so much of a human. He always cared about the staff. And his year as president was that first year of COVID. We were all upside down, not knowing what's going on. Every single call, how is everybody doing? What can I do to help? I'll have a Q&A with them if you'd like. Answer any questions. Every board meeting, thank you to the staff. I love you all. Everybody really felt it. And in the time when the society's internal workings, like are we going to have a meeting or not, your work was upside down, and then your personal life was upside down because of what's happening in COVID. So that was a lot of reassurance that he offered people. He definitely made everyone feel valued, and was definitely comfortable anywhere. The first time I was in, I don't know if it was a taxi or an Uber, I heard him ask the driver where they were from. And I thought, uh-oh. Not uh-oh for him, but I was concerned about the driver. And the driver, was from someplace in Africa. Joel's just like, I was like there, right there, and he named the city where he spoke French, and you could see this driver just completely relaxed because he wasn't sure whether it was a man or woman, where this conversation was going to go. So by the time we get out of the short ride, he's like made a friend for life, because that's what he made everybody feel like. And I have to say, looking at these photos, can anyone talk about how much hair that man had on his head? Oh my God, it was like a ton of hair that he kept until the very end. I was on an email with an NPR reporter who had never met Joel, but had his CV, was going to be writing a piece on him. And she wasn't interviewing me, but I was on that email, and I just wrote a line back to her and said, you know, working with Joel was really a master class in being a good human. She used that quote in her article. So we will end this very optimistic, wonderful session and give you a chance to make some comments, because I know we'd all like to hear from any of you. Okay.
So I'm so proud to stand here today as the daughter of Joel Breman. So many emotions to be standing in his milieu, in his lane, and amongst so many people from his professional and personal community. First, I just wanted to share a giant thank you to the society team, to Karen and to Peter, and then I'll share just a couple reflections. So my dad picked up friends everywhere he went, as we all talked about, and true to his nature, this ASTMH community was so much more than professional for him. He forged truly lifelong friendships that enriched him and all our family. The proof in that has been your continued connection with my mom over these long, tough, very, very sad months. Continuing to reach out and check on her, visiting at her home in Maryland, and this kind invitation for us to be part of this session today in New Orleans. Karen, you continue to shine on ASTMH despite your supposed retirement. I don't believe it. And I don't think any president could have revered their CEO as much as Dad did Karen. Professor J.J. Muyembe, who I had the pleasure of talking with. I think I might have woken you up in the middle of the night trying to get this book out. Rick and his wife Katie, Peter Kilmarks, Roger Glass, Annie, Rimoin, Yeshim Tozan, you continue to stop by when you're in Washington to spend time with my mom, and we're so grateful for that. That is true community, and we really, really appreciate that. Just to share how my dad had an impact, there's a doctor here in our audience, Dr. Ellis, who came up to us at the beginning of the session and said, "Do you remember me?" And I did. He was my father's ICU physician in his final days at Walter Reed, and I really appreciate you stopping by as well today. You treated him with dignity, and we'll be forever grateful for the care team at Walter Reed. So medicine and public health were so woven tightly into my dad's identity, and he reeled us into it in different ways. When I graduated from high school in Atlanta, he gifted me a trip to East Africa, which included a safari to the Serengeti and Ngorongoro and Masai Mara, and we took a trek together up Mount Kilimanjaro. But the real opportunity that he lined up for me, or perhaps it was really for him, was a health project in Malawi overseen by Dr. Rick Steketee, who shared such a beautiful tribute to my dad earlier. Rick and Dad sat me down in rural Mangochi, Malawi. I was all of 17 years old, and explained that there had been an outbreak of some unidentified disease that had killed a large number of newborns across several villages in that area. My assignment? Well, I was to go hut to hut and sit with the mourning mothers to ask them to recount their days leading up to the loss of their babies, how they had delivered them, how they had cared for them in the weeks before their death. Armed with my female translators, one after the other of the mothers described to us a tribal custom of smearing the earth, dirt, on umbilical cords, which had often been cut with the same knife of a tribal leader. Well, it turns out that tetanus was the culprit, and even as a distracted teenager, this rare opportunity was not lost on me. To spend time watching my dad in action, learning from the best field teams, and helping to contextualize for me my good fortunes in life and what really matters at the basis of it all, which is basic health and hygiene. That's a definitely memorable lesson for a teenager. We heard this morning about the many mountains that my dad climbed in his public health career, and I just wanted to acknowledge to this group of people the special last sort of path that my dad hiked when at 84 he became president of the society. He liked to say, well, this proves that the American Society of Tropical Medicine and Hygiene does not age discriminate. In fact, quite the opposite. I watched this as this role gave my dad renewed energy, purpose, connection, access to a young, we were all super young to him by then, access to a young team advancing the society in new relevant ways. He was so proud to share tidbits of what he was learning in his role, and often it would be new things he was learning on the technology front. Leading the organization through the challenges of COVID-19 and the first ever virtual annual conference did not deter him. In fact, I sensed that his cup was just that much more full with interest on how best to navigate the pandemic and the implications all around us. So in many ways, his ASTMH role was life-extending and a great capstone to his unbelievable life well lived, as this symposium is named. Not to be outdone, he was still editing until his very last breath a medical textbook, Principles and Practice of Disease Eradication, published just last month by Oxford University Press, which also reflects a lifetime of public health investigating, learning, and teaching that you all, the current and future generations of scientists and medical professionals, can study and amplify. Thanks to so many of you who authored chapters in it. And as Roger mentioned, his memoir is forthcoming called When All the World is Your Patient, and the final touches are being put on that, including a cover being designed by his granddaughter. So a truly huge thank you so much for honoring my father's legacy and continuing to do the work about which he cared so deeply. Thank you.
I think I have like the 20 minutes on the Hill. I think I have 3, so let me see if I can do this. First, Matthew, Joel's son. Thank you all for being here. This is hard for us, but important. Dad is up above, watching and telling the stories that Annie and others have mentioned, because he loved telling stories. You all know science, so smallpox, Ebola, malaria, Guinea worm, and all the various diseases that you all are working on. But what I hope you also carry on is what we cherish as a family, is the person that Dad was. And you heard parts of that, and that's what made him successful in his work. Commitment and dedication to public service and family, positivity, relationships, mentorship are all critical. Staying positive is really important. If you can let that riffraff that we hear on the news and TV every day go to the side and focus, that's where we'll get somewhere as a society. We heard about how people, forget what you say, they forget what you do, but they never forget how you make them feel. Think about that, deeply in your interactions, because these are the legacies that we as a family think about and try to carry on. And so as a legacy, I'll challenge everyone here to follow the passion. You're here at the meeting. This is part of it, right? Your science. Stay positive. Never forget the importance of relationships that are critical to your success, and mentor along the way. Thank you for being here. And thank you for remembering Dad.
Well, I couldn't think of a better session with all this wonderful reminders of what's really important and what drives everybody at this meeting for doing the work that you do. So with that, and with Joel's spirit in our minds and in our hearts, and I definitely feel him in this room, thank you for coming. It's been a wonderful session, and enjoy the rest of the meeting. And thank you to the family for coming. We really appreciate it. It means a lot.